So far, we developed some FMT products that were delivered by enema to the patients. It is very effective when you want to treat acute graft-versus-host disease, when you want to deliver a high doses of microbiome at the same time. But if we want to move to more prophylactic approaches, it will be much more difficult to give this enema to the patients every week or every month. So we need to develop other mode of delivery. And in fact, in this phase 2 clinical trial, we evaluate the use of MaaT033, that is an optimized oral capsules that allow us to give a gut microbiome, and this is some lyophilized capsules, so patients can take the capsule at home. So in this clinical trial, it was some patients that received an induction chemotherapy for acute myeloid leukemia, and after neutrophil recovery, we give the MaaT033 capsule for 1 or 2 weeks, and it was a dose escalation study. So some patients receive 1 capsule per week, some other patient after 1 capsule per day. After it was 3 capsules per day for 1 week, and in the last cohort it was 3 capsules per day for 2 weeks. And in fact, in this study, we were able to demonstrate that the treatment were safe. We don't have any serious adverse event related to the capsule, and it was also effective, in particular for patients that received 3 capsules per day of MaaT033 with a very good engraftment and also an increase into the microbiome richness as soon as 1 week after the treatment. And most importantly, when the patient received further chemotherapy or antibiotic for the acute myeloid leukemia, we saw that we maintain a high diversity of the microbiome also after induction chemotherapy, with very few infectious complications during consolidation chemotherapy, suggesting that we have already a protective effect on patients' outcome, and we improve patients' outcome. So now we are really waiting to evaluate if this capsule of FMT can be used before and after allogeneic stem cell transplantations to improve patients' outcome, and we expect to test that very soon in the clinical trials.